Today, we are going to discuss the best kept secret in Western medicine to improve our mental health. Before we dive deeper, please pause this video here briefly to read this disclaimer. When we think about physical and mental well-being, we usually look towards prescriptions, procedures, or external interventions. But to truly understand how our minds influence our health, we first need to explore two very fundamental medical concepts. The first concept is the placebo effect, derived from a Latin term meaning "I will please." In medicine, this describes how positive expectations and suggestions can produce genuine, measurable improvements in our mind and body. Conversely, we have the nocebo effect, derived from Latin meaning "I shall harm." This occurs when negative expectations, pessimistic words, or fear-based suggestions have an adverse impact on our health and well-being. To see the nocebo effect in action, we can look at clinical observations discussed by emergency physician Dr. Steve Bierman in his book, Healing Beyond Pills and Potions. In medical trials involving chemotherapy, researchers routinely inform participants about potential side effects, such as hair loss or severe nausea. Remarkably, in many standard trials, even patients who are unknowingly placed in the control group and given an inactive substance, meaning they are not receiving the actual chemotherapy drug, all still experience side effects like hair loss and nausea, sometimes in upwards of 25% to 30% of cases, purely because they expected it to happen. Their minds anticipated the harm, and their bodies responded accordingly. On the other side of the spectrum, we see the profound power of the placebo effect documented in clinical literature. For instance, in clinical trials evaluating treatments for conditions like chronic pain or major depressive disorder, patients receiving inactive sugar pills frequently experience substantial symptom relief, with brain imaging confirming the actual release of the body's natural endorphins and neurotransmitters. This brings us to a vital question. Why did only a certain percentage of people in clinical trials experience side effects or positive healing outcomes? The answer lies in the power of belief, faith, and the subconscious mind. This explains why two individuals facing the exact same medical diagnosis can experience vastly different trajectories. One may struggle deeply, while another finds a path toward remarkable resilience and longevity. This is where we can consciously harness this exact principle to support our own mental and physical well-being from an integrative perspective. Enter Émile Coué, a prominent French psychologist and pharmacist of the early 20th century. He successfully guided many complex patients towards healing by teaching them a simple, structured practice of mental self-direction. He instructed his patients to close their eyes and repeat a specific phrase in a soothing voice. Every day, in every way, I am getting better and better. He recommended repeating this phrase 20 times, first thing in the morning upon waking, and the last thing at night before falling asleep. He achieved remarkable clinical success with this method, which he termed autosuggestion, a process closely related to what we call self-hypnosis or guided imagery. Now, there are often many misconceptions surrounding hypnosis, with stage performances painting a picture of mind control. In clinical reality, medical hypnosis is widely accepted as a potent, evidence-based therapy used to support pain management, reduce anxiety, ease stress-related symptoms, manage irritable bowel syndrome, support sleep disturbances, and assist with habit cessation, like smoking or weight management. However, professional clinical hypnotherapy can sometimes present limitations regarding accessibility or cost. That is precisely why self-hypnosis is such an exceptional tool. Important clinical note: while self-hypnosis and autosuggestion are wonderful complementary tools, hypnosis and deep trance work should generally be avoided or approached with extreme caution by individuals suffering from active psychosis or severe emotional imbalance. As we look at the big picture, remember that this simple technique can yield deeply positive outcomes for your daily life, but it requires dedication. Please remember to be patient with yourself. Commit to practicing it daily, with faith and consistency, for at least 3 to 6 months before deciding whether or not it works for you. To protect your well-being, try to minimize negative self-talk. Instead of repeatedly reinforcing distress, such as frequently telling yourself throughout the day, "I am so depressed" or "I am constantly in pain," try replacing those phrases with a simple, constructive anchor like "I am supporting my healing every single day." Constantly repeating pessimistic declarations does not bring about healing. Rather, it has the potential to cause harm by reinforcing distress within the subconscious mind. As Émile Coué wisely noted regarding autosuggestion, while these practices cannot grant immortality, they ensure that we are actively giving ourselves the best possible chance to heal to the fullest extent possible. If you are interested in exploring these concepts further, including historical clinical case studies on the physical impact of belief, I have listed some recommended readings and links in the video description below. Thank you for watching. If you want to learn more about integrative medicine topics, please click on this next video right here. I'm Dr. Sharma, wishing you physical, mental, and spiritual balance. May all beings be happy. May all beings be healthy.